This is a view of Haiti.
Hello from Haiti. We're team number 5, and this is our first day here, and we got experience. We had a lot of things go on that we didn't expect, a lot of things that we were kind of expecting, but overall I'd say everybody believes it was a great day. We also took care of patients who had obvious injuries from the earthquake that had been treated before, but we took care of somebody today that didn't get any care prior to getting here. So this is their first real encounter with medical care. She had, unfortunately, what gangrene of her foot, and we had to do an emergency amputation in order to save her life. These are some of the things that we're experiencing on our first day. It was truly an experience. It's truly great to be here. We're truly needed to be here as members of a team that are providing care that these people otherwise wouldn't get, and are so thankful for receiving.
It's an experience beyond words. It's the most incredible and resilient people in the worst possible situation, something that there are not even words to describe. So to be here and be able to care for them in whatever means we possibly can is a true privilege and an honor. It's an experience I would wish for anyone to be able to come and give to these folks. Working bare bones, but all in all, I think our outcomes are gonna be very positive for them.
My name is Sean Troutman. I work in neurotrauma critical care, and I guess my biggest experience today was we had to put in a chest tube for a patient who had a spontaneous pneumothorax without a chest tube. So we had to improvise a little bit, and our great doctors, Raul and Dr. Johnson, came up with the idea of putting a Foley catheter in his chest. So we put him, gave him a lot of lidocaine and a little pain medicine, and we put a Foley catheter in his chest, which we then hooked up to a makeshift water seal container using a saline bottle. So that was pretty interesting. And then we had to transfer the patient out to the University of Miami hospital at the airport here. So it was quite the experience learning to improvise with the little supplies and the resources that we had. But I think we did a good job for what we could do. A lot of the people are starting to come in for things that they would normally go to a hospital for, but they don't. There is no hospital, so we're the only healthcare that they can receive. So the patients that I saw were very grateful and really thanked us a lot for what we were doing.
I did a lot of stuff today. I did put stitches in, which I haven't done for years. ID doctor, don't put stitches in. But the most amazing thing with this case and another case who has a patient who had a perforated appendix is that these people are having regular, everyday problems, and they would they would just die because all the hospitals are closed, all the clinics are closed, nothing's open. So the people that are having regular medical problems wouldn't have this care. They would just die of sepsis, or this pneumothorax guy would have died. So I think that's pretty cool that we're running this hospital.
Well, today was a good day. We did 2 reconstructive cases on patients with fractures from the original day of the earthquake, and we're able to do surgery not like we'd like to at home, but we actually really the team from University of Maryland and Shock Trauma were awesome. So we had a great team effort and accomplished some good care today, I think.
I actually had a good day. It was obviously a little difficult starting to find where equipment was, but it worked out well as a team effort and trying to get the surgeon started on time. But we're a little delayed, but we got her done, and I'm looking forward to tomorrow.
Well, it's been different experiences, and a lot of things have changed from the first trip down to now. So it's been kind of like trying to get adjusted today, trying to find where things are, what we're doing, and get prepared for our cases for tomorrow. But it has changed. I think there's been a lot of progress made with the hospital, how it's set up, and how they have a pharmacy and some different other things that were not available when we were here the first time around.
Hi, I'm Gesley. So I don't know how.
I'm an ID fellow at University of
try to
Maryland.
I'm going to try to send Bill over there or
born
somebody,
and
but he
raised
has
in
to go with
Haiti.
somebody else, so I don't know.
So I came back
Two of us that go, or him and somebody
to
else
help
from
out and be
CRS,
part of
I
this
guess.
great project. And so far, we've been able to do a lot of good work.
So, but I take it we don't have.
you know,
I take it we don't
put
have a
some
list
smiles.
of like what should be over
So,
there, do we?
I guess in the midst of all of
okay.
this, you know, I'm still pumped up. People are trying to pull me out, but this is where I need to be. So, if there are people out here who knows how it's done, they need to let them know to leave me here, okay? Because the help is needed.
So I'm Dr. Redfield. I'm with the ID Division, Institute of Urology. And it's really a great pleasure to see particularly the shock trauma team come down here and make the impact that they've made. I know Dr. Johnson talked earlier today about, even today, almost 7 weeks after the earthquake,
Yeah, so I think
an elderly lady came in with a trauma to her foot
yeah, so
that
Dr. Johnson's going to work
was
on
gangrenous
that to see what he can work out about
and she needed to have an
possibly getting
emergency
down from
amputation.
materials to-
But
because
I'm
we
not
had
sure what he
Dr.
said
Lewis over
about
there, and
what a
the
small
way
world it
we
was,
turn over,
because it
like,
turns out that
nobody,
this
like,
97-year-old
we make
woman
them
who
at
had
the
to have an
airport, not here,
amputation
so we have
was
to
accompanied by
basically, once we
her
get here,
daughter.
look for everything.
And it turns out that her daughter
You know what I mean?
was
So that
a
makes it
nurse
confusing.
that was
Yeah, but it
currently
doesn't tell you
working
where
in the
stuff
state of
really. I mean, it
Maryland
kind
and
of
came
gives you a
back to help
layout of where
her mother
things are,
here.
but
And her mother actually goes to the same church that Dr. Johnson goes to.
right.
So
we're going to
it's
try
just
to
a
send
reminder that the
somebody
world is a
tomorrow.
lot
That's
smaller
gonna
than we
happen,
think.
but we'll work on